Good morning, everyone. As we tackle Mpox as a public health emergency of international concern for the second time in 2 years, I want to convey 3 basic messages today on behalf of WHO Europe. Message number 1. Mpox is not the new COVID. Regardless of whether it's Mpox clade 1 behind the ongoing outbreak in East Central Africa or Mpox clade 2 behind the 2022 outbreak that initially impacted Europe and has continued to circulate in Europe since. We know quite a lot about clade 2 already. We still have to learn more about clade 1. Based on what we do know, Mpox primarily transmits through skin-to-skin contact with Mpox lesions, including during sex. This leads me to message number 2. We know how to control Mpox. And in the European region, we know the steps needed to eliminate its transmission altogether. 2 years ago, we controlled Mpox in Europe thanks to the direct engagement with the most affected communities of men who have sex with men. We put in place robust surveillance, we thoroughly investigated new cases contacts, and we provided sound public health advice. Behavior change, non-discriminatory public health action, and Mpox vaccination contributed to controlling the outbreak. Learning from our success, we urge governments and health authorities to sustain those measures to help eliminate Mpox from Europe. But through a lack of political commitment and a lack of resources, we failed to go the last mile. And today we're seeing about 100 new Mpox clade 2 cases in the European region every single month. However, the current state of alert due to clade 1 gives Europe the opportunity to refocus on clade 2, a second chance, let's say, to strengthen Mpox surveillance and diagnostics, to issue public health advice, including to travelers, grounded in science, not in fear, not using stigma, and not through discrimination, to procure vaccines and antivirals for those who may need them, based on a strategic risk assessment. In sum, even as we strengthen vigilance against Mpox clade 1, we can and should strive to eliminate clade 2 in Europe for once and for all. And this brings me to message number 3. The need for a coordinated response is now greatest in the African region. The Africa Centers for Disease Control and Prevention declared an Mpox continental emergency shortly before WHO's global declaration. Europe must choose to act in solidarity. Solidarity with individuals and communities impacted by Mpox, by working directly with them to take charge of their own health. And solidarity with the WHO African region and its affected member states, both at this critical time and in the long term. In 2022, Mpox showed us it can spread quickly around the world. We can and must tackle Mpox together, across regions and continents. So will we choose to put the systems in place to control and eliminate Mpox globally, or we will enter another cycle of panic and then neglect? How we respond now and in the years to come will prove a critical test for Europe and the world. Thank you.